Hello, I'm Donna Mazik, Executive Director of the National Association of School Nurses, and we welcome you to today's webinar, Connecting Health and Learning Through ESSA, Opportunities for School Nurses. The National Association of School Nurses, the Alliance for a Healthier Generation, and Healthy Schools campaign partnered to bring you this conversation about health and learning. We know that students face barriers to health and learning that must be addressed, and we'll talk about that today. Today's speakers, in the next slide you'll see, are, I'll be moderating, and we have Anessa Bontrager, who's a project manager at the Alliance for a Healthier Generation, Alex Mays, who's National Program Director at Healthy Schools Campaign, and Eva Stone, District Health Coordinator for Jefferson County Public Schools, and that's in Kentucky. So we're really excited to share this time with you. Next slide, please. To tell you a little bit about NASN, or NASN, we're a member organization with a mission to optimize student health and learning by advancing school nursing practice. We know that when students experience better health, they have better learning. But we also know, as we stated, that there are barriers to health and education. And today we'll find out more about what opportunities there are for school nurses to make sure that students are in school healthy, safe, and ready to learn. You're seeing here this framework for 21st century school nursing practice. The National Association of School Nurses in 2016 developed this framework. And what we do with this framework is show 5 key principles that guide the practicing school nurse to reach the goal of supporting student health and academic success by contributing to that healthy school environment. And we are going to tell you more about that as we move forward. So next slide, let me introduce to you our first speaker. Anessa Bontrager is Project Manager at the Alliance for a Healthier Generation. She resides in Arlington, Virginia. Anessa holds a Master of Science in Health Promotion Management and is currently pursuing a Doctorate of Education in Health and Physical Activity. At Healthier Generation, Anessa works on local and state-level policy efforts with a large focus of her work centered on integrating health and wellness components into the Every Student Succeeds Act. Anessa loves traveling, trying new activities, and being outdoors with her dog, Ziggy. Welcome, Anessa.
Thanks, Donna. Hi, everyone. I'm really happy to be here today discussing the important role nurses can play within ESSA. So if you want to go to the next slide, you may hear ESSA referred to as the Every Student Succeeds Act, ESSA, or ESSA. Just know that they're all synonymous. I'll be providing an overview on where some health and wellness opportunities lie within ESSA. But first, let's do a little background. So the Every Student Succeeds Act is the latest reauthorization of the Elementary and Secondary Education Act, which is the law that governs K-12 public education. ESSA was signed into law with bipartisan support in December of 2015, with the purpose of ensuring that every public school provides a quality education for all students. ESSA replaced No Child Left Behind. And under ESSA, there's now more flexibility and decision-making at the state level than was allowed with No Child Left Behind. Perhaps the most exciting part for advocates like us are the new opportunities states now have to support student health and wellness. Next slide, please. So most of the opportunities for health and wellness lie within these buckets, and that's the accountability systems, state report cards, professional development, the student support and academic enrichment grants, and the needs assessments and their corresponding school improvement plans. So let's dive a little deeper into each of these opportunities. Next slide. So when it comes to accountability systems, that refers to a set of indicators that states have chosen to measure school performance for all students and subgroups of students. So for example, English learners would be a subgroup of students. Schools and student subgroups not meeting the minimum benchmarks are designated as needing improvement. LEAs are then required to dedicate resources to improving these schools or student subgroups. One indicator must measure school quality or student success, and this is a great place to insert a health and wellness measure, as you'll soon see. Next slide, please. So here are some accountability metrics. So for the indicator measuring school quality and student success, the majority of states, which is 36 plus Washington, D.C., chose to use chronic absenteeism as their indicator. Access to physical education, physical fitness, and a combination of factors related to school climate were chosen by the rest of the states. So as you look at this slide, if your state is not listed in the last 3 bullets, then it falls under the chronic absenteeism bucket. And I'll stay on this slide just for a few more seconds so you can see where your state lies. It's important to know what indicators your state has chosen. Next slide, please. So a little bit more about chronic absenteeism, since it was so widely chosen. It's often defined as missing 10% or more of school days for any reason. So this should include excused, unexcused, and suspensions. AttendanceWorks is a great resource to learn more about chronic absenteeism if you're interested. It has been proven that high chronic absenteeism rates are an early warning sign of academic risk and school dropout. Research also shows that student health and a school's health and wellness environment are key factors that contribute to a student being chronically absent. So one way that nurses can highlight the importance of student health and influence their school's health environment would be by serving on their school's attendance teams. Next slide. State report cards. So under ESSA, states are now required to publish and widely disseminate graded or ranked listings of schools in a format and language that parents can understand. So states can choose to provide measures of health and wellness as a form of public accountability, in addition to other required measures. Next slide. Professional development. In the past, funding for professional development could only be used to support core academic competencies. However, under ESSA, professional development can be used more broadly. So for example, it could be used among health and physical education teachers or specialized instructional support personnel, such as school nurses. This professional development could be specific to just school nurses or be given to all staff around student health topics. For example, creating an asthma-friendly school. Next slide. The Student Success and Academic Enrichment Grants, or SSAEGs, are formula grants where are formula grants and they're pools of money where 20% of the funding must be appropriated to improve the safety and health of students. So in the follow-up materials, we'll actually provide a resource where you can see how much money your district is receiving. These Student Success and Enrichment Grants are a great place to advocate for health-related initiatives. Next slide. Needs assessment and the whole child. So needs assessments are utilized by underperforming schools to understand the root causes of poor academic performance. It's vital to consider physical and mental health, hunger, housing stability, safety, and many other factors, many of which are included in the whole school, whole community, whole child model. So school nurses can play an integral role in gathering data for the needs assessment because who knows the student and school health better than you? Next slide. School improvement plans. They are strategic plans created to address deficiencies identified by the needs assessment, and they must involve evidence-based practices. So this is an ideal place to address all factors that may be impeding academic performance. For example, if a child's hungry, we know that they're not going to learn as well. So utilizing a school breakfast program, or perhaps even better, an alternative meal program, such as breakfast in the classroom. School improvement plans are another great place to insert health and wellness initiatives and evidence-based practices. Next slide. So in terms of an ESSA timeline, because state plans were approved at different times, each state will create their own process and timeline, but a general timeline may look like this. So last school year, which would have been 2017-2018, plans were submitted and approved, and data should have at least started to be collected to use in the state's accountability system that we talked about earlier. Now, that data will then be used to publish a graded or ranked list of schools based on the said accountability system. That could occur during the fall of this year. During the winter of 2019, which is just this, would be January and February of 2019, underperforming schools may complete a needs assessment and develop a school improvement plan. School year 2019-2020 would then be dedicated to implementing the school improvement plan. During the fall of 2021, the next graded or ranked list of schools will be published. So as you can see, this is a multi-year cycle. Next slide. And here are some great resources and ways to begin engaging around this topic. So when we send out the follow-up materials, you can click on this link from the National Education Association or visit your state Department of Education website to review your state's plan and progress. You can start a conversation with your State Department of Ed staff, State Board of Education members, or other staff on where your state is with ESSA implementation. Locally, ESSA offers LEAs and schools opportunities to rethink their programs and spending to better support student outcomes. There's a really big push under ESSA to partner with other organizations to achieve your state's goals. So talk with community partners like civic organizations, out-of-school time programs, departments of health, or other peer and district schools. Lastly, bring these health and wellness related opportunities to your local wellness committees. The local wellness committee is the keeper of most health and wellness data and can play a huge role in terms of the needs assessment. And with that, I'm going to hand it back to Donna to move us forward with the webinar. Thank you.
Thank you very much, Anessa. And I want to invite the webinar attendees to please write questions in the question box. We will take time at the end of all of the presentations to make sure we go through those questions. So please put those questions in the question box. We have a couple of questions now. We see those, and we'll take all of those at one time at the end of all three presentations. I'd like to introduce now Alex Mays. Alex is the National Program Director at Healthy Schools Campaign. In her role as National Program Director, Alex works on policy and program issues at the federal, state, and local levels related to school food and fitness, health services, and education. Currently, she leads Healthy Schools Campaign's work to increase access to school health services through Medicaid reimbursement and the organization's efforts to support student health through implementation of the Every Student Succeeds Act. Welcome, Alex.
Great. Thank you so much, Donna. And on behalf of Healthy Schools Campaign, I just want to thank National Association of School Nurses and the Alliance for co-hosting today's webinar. We're honored to be co-presenting on this webinar with you all. So again, my name is Alex Mays. I'm the National Program Director for Healthy Schools Campaign. For those of you who aren't familiar with Healthy Schools Campaign, we're a Chicago-based nonprofit, and we work to ensure that all students and staff have access to a healthy school environment that supports their ability to learn and work. And core to that work is supporting increased access to school health services and programs through implementation of the new education law, the Every Student Succeeds Act. So we're excited to share more about that work with you today. Next slide, please. So what I want to do today is build on the great overview that Anessa gave of the Every Student Succeeds Act and dig in more around some of the opportunities that are presented through the inclusion of chronic absenteeism within the law. As Inessa shared, the new education law, the Every Student Succeeds Act, presents a really exciting and important opportunity for supporting the work that you all are doing day to day. The law really recognizes the importance of supporting the whole child and the role that physical and mental health can play in student success. And there's a lot of flexibility that is given to states and school districts in terms of how that vision is realized. Which is why it's so wonderful to have so many people on today's webinar to be able to share that with, because there's a tremendous role for individuals who are working in schools, in districts, advocates that are in states, to really make sure that the connection between learning and health is elevated through implementation of the Every Student Succeeds Act. And one of the key opportunities for doing that is the inclusion of chronic absenteeism within the law, and then the decision that a number of states have made to really integrate chronic absenteeism within their accountability systems. As Inessa shared, chronic absenteeism, just most generally defined, is missing so much school for any reason that a student is academically at risk. We like to use the definition put forth by Attendance Works, which specifically defines it as missing 10% or more of school for any reason. And why this is so important for our conversation today is what this really does is lets us include those excused absences that students might be missing due to chronic health conditions or other health issues that are keeping them out of school. When you just look at issues such as truancy that are based on unexcused absences, you miss those students who have chronic asthma or missing school because of diabetes or mental health issues. And so chronic absenteeism really presents a powerful way to capture that and serve as a health proxy measure for student health and wellness. And as Inessa shared, 36 states in Washington, D.C. have decided to include this as a part of their accountability system. And all state school report cards now include chronic absenteeism. And this fall, those report cards will come out. And so the schools that you're working in will have chronic absenteeism on those report cards. Many, it'll be the first time that it's on there. And that presents a tremendous opportunity to engage with decision makers at your school, in your school district, about the role that you all can play in addressing chronic absenteeism and the role that health and wellness plays in keeping kids out of school. Next slide, please. We also know that chronic absenteeism disproportionately affects certain populations of students. Specifically, low-income students of color are more likely to be chronically absent than their peers. And so this is also incredibly important for linking the work that you're all doing to support the health and wellness of students to key issues that educators care about, such as the academic achievement gap. That's always been a core focus of education policy and programs like the Every Student Succeeds Act. When we look at these disparities in terms of chronic absenteeism rates, it's really important to think about the role that these plays in contributing to the academic achievement gap. Because we also know that many of these populations are also disproportionately impacted by chronic health conditions, and that low-income students are more likely to suffer from issues such as asthma and diabetes, as are students of color. Next slide, please. And so what we really want to dig in today is just, really highlighting what you all can do around chronic absenteeism and the opportunities that the new education law presents for addressing it. So we know that the causes of chronic absenteeism are multifold. By no means are we saying that it's just health issues. We know that health conditions are, though, a leading contributor to chronic absenteeism. And the way that we like to think about the causes of chronic absenteeism, we defer to Attendance Works. Again, Inessa mentioned Attendance Works. They're a fantastic resource. If you haven't visited their website, attendanceworks.org, we'll send out a link to it. But a number of these slides include content from their slide deck. So the way that Attendance Works categorizes the causes of chronic absenteeism are into the buckets of myths, barriers, and aversions. And so for myths, it's really thinking about, misconceptions around why things such as that attendance only matters in the older grades and that attendance during kindergarten doesn't matter. And what we actually see is that chronic absenteeism rates among kindergarten students are one of the highest populations that are impacted by chronic absenteeism, and that in fact, students who are chronically absent in kindergarten, that has significant impact on their academic outcomes down the road. For barriers, that's really where we see a lot of the health issues, and specifically chronic disease and the role that that plays in keeping kids out of school. Students that have asthma, that have mental health issues, and oral health issues, all are leading causes of chronic absenteeism that keep kids out of their seat from learning. And then finally, aversions, and this is where we see things that, such as related to bullying and not having a positive school climate that really helps students feel engaged. Students who are struggling academically, who may just feel like they don't want to attend school anymore and stop coming. And so this is just what we see as a helpful way to think about the various causes of chronic absenteeism. Certainly health playing a key role in a number of these, but I also just want to emphasize that, by no means are we saying that school nurses should take on everything. We know there's a tremendous amount on their plate. But really, school nurses can play an incredible role in addressing a lot of these root causes of chronic absenteeism, from myths and just being trusted stakeholders that are within the schools that can educate parents about the importance of attendance in earlier grades, to barriers, certainly in terms of delivering health services and programs that can ensure students are healthy and ready to learn. And again, with aversions, really helping educate families and staff around how they can create supportive school and climate, really identifying kids, for example, who are showing up in the nurse's office with a stomach ache and recognizing that there might be something more going on, such as bullying, and thinking about ways in which that can be addressed. Next slide, please. And so while we know the causes of chronic absenteeism are multifold, the good thing is that there's a lot of wonderful research out there showing that this is an issue that can be addressed, that there are evidence-based interventions that they can be used to turn this issue around. Really, thinking about Tier 1 interventions, which are universal interventions that impact all students. We know school climate initiatives that really focus on creating positive relationships with school staff and making students feel that they're safe and supportive can play a key role in impacting all students and making them feel like they want to be in school learning. Tier 2 is really where, school nurses shine in terms of delivering those health services for students and health programs that can address the chronic health issues that are keeping kids out of school, such as creating asthma management plans, to help students manage their asthma, really focusing, serving as a caring mentor, helping identify mental health issues, connecting students with care outside of the school, tremendous role that school nurses can play in terms of delivering those Tier 2 interventions. And then finally, Tier 3 are the really individualized interventions for the kids who are severely chronic absent, which we define as missing 20% or more of school. And that's where we see often a lot of coordination with providers and agencies outside of schools, so really looking at factors that may be happening outside of the school, such as issues related to housing, and coordinating with those other agencies to develop appropriate responses. Next slide, please. And so what I really want to bring us back to is that we really see this as a watershed moment for addressing chronic absenteeism and really lifting up the wonderful work that school nurses lead across the country. With the implementation of the Every Student Succeeds Act, there's a significant shift in how we think about education policy and programs. The predecessor of Every Student Succeeds Act, which we all knew as No Child Left Behind, really solely focused on academic standards the Every Student Succeeds Act really defines success by a much broader array of standards, including those related to health education and physical education. Again, there's a tremendous amount of flexibility under the Every Student Succeeds Act. States and school districts can really determine where their needs are and think about how they want to address those in a unique way and have the flexibility to do that. So it's a chance for you all to speak with your principals, with your administrators about the role that health services and health programs can play in supporting student success. And then finally, just the inclusion of chronic absenteeism within the Every Student Succeeds Act under No Child Left Behind. The focus really was on truancy and those unexcused absences, which didn't create the opening for thinking about the role that student health issues played in keeping kids out of school. And No Child Left Behind also really focused more on punitive interventions, whereas the Every Student Succeeds Act gives us the space and flexibility to think about things like prevention and early intervention and ways in which we can support the mental and physical health of students. Next slide, please. And just again, to emphasize that many states now include chronic absenteeism in their accountability systems. And this slide just shows how chronic absence really meets the requirements that were included in the new education law for establishing school quality measures. So we find these are just helpful talking points if you get pushback for some reason around the inclusion of chronic absenteeism in accountability systems, you know, emphasizing what a strong measure it is and that it really does meet all those requirements of the law. It can be an effective case to make for its inclusion. And then on the next slide, just finally, I want to wrap up by really highlighting the role, again, that this presents for school nurses. You know, with the inclusion of measures like chronic absenteeism, school climate, physical education in state accountability systems, and then the inclusion of chronic absenteeism in report cards, it's a tremendous opportunity for school nurses and health providers and advocates of health programs and services to really connect the work that you're doing to those accountability measures. You know, we encourage you to really make the case for how your work does, you know, can help meet these accountability measures. Talking about the role that health services can play in impacting attendance and creating a supportive school climate, and helping students meet academic outcomes. So just, I think it's really important to recognize that now the education world is really, you know, thinking with these new accountability measures in mind. And so it's a helpful shift for us all to make in terms of thinking about how we can connect the programs and services that we want to see in schools to those accountability measures. In addition, it's an important opportunity to really bring your expertise to the table. ESSA mentioned that underperforming schools are now required to do needs assessments. Many schools have done needs assessments prior to ESSA and will be doing them regardless of if they're identified for as underperforming. And that, again, just presents a key opportunity to make sure health and wellness is included within those needs assessments. You know, if you know that your school is identified as underperforming, or if you know that your school is going through a needs assessment, get a seat at the table and ask your principal, ask your superintendent what's happening around us. And it's a great chance to just make sure key health and wellness questions are included within those needs assessment. You know, whether it's as simple as just including a question about what the leading health issue is that's impacting your student population. It can be a great way to really help drive decision-making and the allocation of resources to make sure that the connection between learning and health is supported. And we do have a guide that's linked to at the end of this that highlights some of those questions that can be included within needs assessments to make sure health and wellness is integrated and is recognized as a contributing factor to underperformance of schools. And then finally, just to again emphasize the flexibility that's within the new Every Student Succeeds Act and the chance to really make sure that resources and support for school health services and programs can be used under the new law and can be used to support efforts to address chronic absenteeism and other issues more broadly. There's a lot of flexibility around how funding for low-income schools and professional development and grant funding can be used. And certainly, can be used to support school nurses, behavioral health providers, professional development for staff around how they can really address the root causes of chronic absenteeism. So it's a chance to really think, innovatively about how you want to see education dollars used, and to really, again, make the case for the role that school health services and programs can play in meeting chronic absenteeism and those other accountability metrics. And on the last slide, there's just a list of resources. These slides will be available. We'll send out a link to them by the end of the week. And there's just a number of good resources here, which include a lot more information about the inclusion of health and wellness within the Every Student Succeeds Act, and specifically interventions for addressing the health-related causes of chronic absenteeism. So look out for those resources, which will come out later this week. So I will now hand it back to Donna to introduce our next speaker.
Thank you, Alex, for all of that information. And what I'd like to do now is introduce our third and final speaker for this webinar. Eva Stone is an advanced practice registered nurse and co-chair of the Kentucky Nurses Association School Nurse Initiative called Every School Needs a Nurse Every Day. This initiative involves advocating for a full-time nurse in every public school in Kentucky. Eva worked as a school nurse for 16 years and knows school nurses should be a part of long-term planning to improve student health and learning. Eva will share with us now how chronic absenteeism decreases when school nurses are part of the school team. Eva, welcome.
Thank you, Anna. I appreciate it today. Next slide, please. As Donna says, I am a school nurse. I've been a district health coordinator for a number of years, and currently I work in Jefferson County Public Schools as the health coordinator, where I've been since January. Next slide, please. So historically, my work has been in rural school districts in Kentucky, and through that work, we had the opportunity several years ago. I really just tell a story. We started looking at our numbers and looking at the kids that were absent from school. And any school nurse can tell you, we have students that repeatedly come back to the office, and a lot of times it was the same kids over and over again. And so when we started looking at those absences and the number of days students were missing, what it seemed like is everybody was really focused on the note that kids brought back to school. And that just didn't make a lot of sense to me or the staff that I worked with, because at the end of the day, they weren't at school. And so if you're not there, you're going to learn, and not going to learn. And no matter what intervention you put into place, if they're not there, they're not learning. And so we really started trying to look at this data and figure out what was going on. And at the time, I was working with one of our specialists at our middle school who's very good with numbers. And she came back to me and she said, I've really looked at this list of students who are missing 10% or more of school. And it's really not as big as it looks. It's the same group of students who are responsible for most of the absences that we're having. And it's those same students, if you cross-reference that list, that you'll see are the students that aren't performing academically. They're not academically where they need to be. And so within my group, we started talking about, okay, what are some things we can do about this? What are some things that nurses can do to intervene? And really the most striking moment, it just so happens at the time we had a registered nurse in every school, so we really had the foundation for what we needed to do this intervention and do it well. But there were interventions underway for the schools to improve activities. And so one day we had a principals meeting, the whole administrative team was together, and we were desegregating data. And so we were looking at outcomes across the district. And so I had the opportunity we were doing rather a gallery walk, and so I had the opportunity to take the number of absences we'd had for the previous year and put it on a Post-it note and stick it up on the wall with some of the other indicators. And when you put a Post-it note up that shows something like 38,000 absences, which is what I believe the number was, that tends to start getting educators' attention. And so that's when we really started talking about, how do we get at the issues that we're having with absenteeism? The other thing that happened, though, was we had a superintendent at the time that really understood the connection between health and academics. And I really want to emphasize that this isn't just about the physical health. It's about physical and social and emotional health. But the school nurse can really be the gatekeeper for that, because so many times when students come to the health office, they're coming with the complaint of a stomach ache. But when you spend a few minutes talking to that student, you know that there's really another issue going on. Next slide, please. And so just my involvement as the health coordinator at the time, again, was to look at the data on chronic absenteeism from a district level and then start reporting that individually to the school so they could see their chronic absenteeism data. And then we developed a process for intervention, but we did that as the administrative team at central office. We started talking about, okay, how can we intervene for the attendance issues that we're having and these barriers kids are facing? And then we discussed this with the principals and again garnered support. Next slide, please. So the way the school nurse was involved in those things, first of all, we had standing orders in place in our school district. And so we had orders where school nurses could administer medications for students with conditions that they might be able to go back to class. It didn't necessarily warrant sending a child home. They might have a bit of a headache, and rather than the parent having to miss work and the child having to go home, we were able to treat the child and send them back to class. And parents were very appreciative of that as well. And then a very important standing order we had was albuterol for our children with asthma, because many times we have kids with asthma that might have mild asthma, don't have flares very often. And in the rural area where I was, it might be that the parent their insurance would only cover one inhaler. And the parent didn't want the inhaler at school and the risk of not having it at home. And so they wouldn't send an inhaler to school. And so we just decided to reduce that barrier. We've got nebulizer compressors, got an order to have albuterol, and we initiated standing orders to treat asthma at school. We worked very hard to develop health plans for all our students with chronic health conditions so that we had things in place to intervene when they needed help. And the school nurse is very involved in care coordination. School nurses are constantly working between parents and healthcare providers, school staff, and of course the students themselves to make sure that services are coordinated. Our nurses spend a lot of time teaching children with diabetes to calculate carbs, to self-manage their asthma or other chronic conditions, and also to be working with the healthcare providers to communicate those things. And so that was a very important piece. And then we also formed teams at every school. And, schools use the terminology PLCs a lot, professional learning communities, and they encourage teachers to get together grade levels across grade levels to discuss very specific school needs and student needs. And that is, in a sense, what we formed. We formed a committee at each school that looked specifically at attendance and chronic absenteeism. Next slide, please. And so again, we established what we called at-risk teams at each school, and they were comprised of the school nurse, the principal, counselor. In Kentucky, we have Family Resource Youth Service Centers, and being in a rural area of Kentucky, all our schools were served by a center. The attendance clerk was part of the committee because the attendance clerks are the ones who tended to know the families and things that were going on with the families. Myself as the health coordinator participated, and then our director of pupil personnel was part of the committee as well. Our elementary teams met each month. The middle school teams, and that was just based on the size of the school. The middle school teams met twice a month. The high school team, because they were the largest school, they met every week, and of course they had the largest percentage of children who were chronically absent. And so at each of these meetings, we reviewed the list of kids who were chronically absent, and then we assigned follow-up depending on the identified needs. If there was a health need, we routed that to the school nurse, If there was a social need, we utilized our family resource centers. And if there was an emotional need, then we utilized the counselor. Next slide, please. And so for our data, we started out, when we began the process, we had just over 18% of our students that were missing 10% or more when we started, and that decreased to 12.3% the following year. It raised a little the next year to 13.7%, and I think that was just the difference in one of our alternative schools. But we did end up, at the end, by year 3, there were 152 fewer children who were chronically absent. Next slide, please. And so just to talk a little bit about this in the framework of the Every Student Succeeds Act and then the school nursing framework, you know, school nurses, they provide for student well-being that's protective and very strong. And so school nurses can lead school health teams. We integrate the services into that spectrum of care for students, and we coordinate care for the child across home and school settings. Very importantly, we address barriers to learning and teaching, and those are those things that impede school attendance, and school nurses can really get to the root cause of those, and relationships with families can make a big impact on chronic absenteeism as well. Next slide, please. And so again, some of the things that the school nurses do, identify students missing required immunizations. I want to speak to that to say that when there are children who are not fulfilling those requirements to attend school for physical exams, for vision screenings. In Kentucky, we have a dental screening requirement for immunizations. My question is why? And so a lot of times the mindset is, well, we're just going to exclude students if they don't have these things done. And I would say if you've got children in your building that aren't having their required preventive health exams, then they may not be connected to a medical home. And that's significant as far as their attendance and missing school. So those are important triggers for us to pay attention to. Of course, we assess students, we identify health concerns that are undetected, and again, as we did, participate on teams that collaborate to support students at risk and promote health habits. And again, identify social factors that adversely impact attendance and well-being. Next slide. And so just as an example, I had a middle school nurse once that her first days on the job, she was slammed with students. I mean, just from day one, her office was full of kids. And so she very quickly picked up on, number one, the kids that were going to be regulars in her office. But there's a second thing. Within a week of her job, she told me that what she was noticing was that a lot of these kids coming to her office were having anxiety. And again, this is significant because it may not be clinically enough that it would get routed to the counselor that there's a concern in this student, but it's under the radar enough that these are the kids that fall into the cracks. And like Alex mentioned, is there bullying going on? Are there other things going on? And the nurse is a trusted individual who will help get to the bottom of that. And again, just some other measures here that school nurses can participate in. It's very important to look at the social determinants because they have a big impact on student attendance. And if you look at your data in your own district on chronic absenteeism and you cross-reference those lists of students with the students that aren't performing academically where they need to be, and your list of students who are eligible for free or reduced lunch, then I think you will see just across the board a strong connection. Next slide, please. And so just as administrators of the health programs, I think it's very important to look at policies that may impact student attendance and these policies that may be sending a message to parents that students aren't welcomed at school. And so if the district is very punitive in its approach to kids who haven't had required immunizations, who haven't had vaccines or physicals, these absolutely are things that we need to monitor and follow up. But I think if we frame that as looking at it as a trigger for an underlying issue rather than a reason to keep kids out of school, it's very important because everybody wants to feel welcomed at school, and that's important on the part of the child, but also we don't want to give parents reasons to not send children to school. So we need to reframe how we're looking at implementing our policies to get parents to do what we want them to do. Again, as I mentioned, consider that when kids don't have required access, when they don't have their physicals or immunizations, they may have a lack of access to care. And it's important to share the data about the impact of chronically absent students with your administration. So if you've got a school that's not meeting benchmark, as was discussed earlier, and they're looking to get out of whatever they're having to monitor because they're not meeting the benchmark standards, if they can impact their chronic absenteeism, that's going to help them get out of their low achieving status, or however that's framed. And so you won't get those students that are missing the most school, but you'll get those students that kind of are teetering on the edge, and that actually can help move a school along. And so it's important to use that in your conversation with administrators, or show them that data that will help them understand the impact of health. Next slide. So now I'm in a district with significantly more students. I don't know that I said there were 4,000 students in the district where we implemented this, and now there's 105,000 students in 155 schools, so it's a lot bigger. But the issues are the same. And what I've noticed is our issues with students are the very same issues. And so in my current district, our chronic absenteeism ranges from 3 to 44% among schools. And so you can see the wide variety and the difference in this as an issue between schools. Next slide, please. So what I think it's important for all of us, for school nurses especially, but for anybody who's working with chronic absenteeism, is to know your numbers. You need to know the numbers of chronic absenteeism. We have an electronic student data system, which I think most districts have. And so I'm able to run attendance reports. And what I do is I run a report, like at the start of the school year, I'll run a report for the last school year, and I will look for those students that missed 17 or more days of school. And that will give us a list of kids just to have on our radar to start the school year with. We need to be intentional with our nursing interventions. A lot of times we'll talk about putting nurses in school in schools as a measure to move schools along, but just putting a nurse there doesn't make a difference consistently across the literature. What you have to do is have a nurse there who is specifically providing interventions that can impact student outcomes and attendance. And asthma, for example, or any chronic health condition is a very big indicator. We need to think about the practices that we have and what we're doing, and how those policies and how our procedures and how our follow-up with students impact attendance. We need to collect and share our data, and we need to communicate that data. Next slide, please. There are lots of opportunities around this, looking at chronic absenteeism around school nursing and school health in general. One, just with the Affordable Care Act, was discussion of population health. So we have hospital systems that are more interested in partnering with schools and at looking at the health of the population. And when we have children that don't graduate from high school, they don't consistently go on to become employable adults. And so your chambers of commerce, your businesses are interested in our success in successful education of students. But we also know that if a child doesn't graduate from high school, the less education they have, the more likely they are to have poor health later on. So this is of interest to our hospital systems that are working with population health. We need to increase the emphasis we place on the social determinants of health, because that's across the board. Again, the Affordable Care Act is encouraging us to look at that. And we who work in schools know that the social determinants have a big impact on health in general, on school attendance. Our healthcare providers are being, payment reform is happening, and so quality indicators are how payments are based in a lot of areas. And so again, children having physicals and immunizations and well-managed chronic conditions is of value to hospital systems. Across the United States, we have an increased emphasis on safety in schools. We had a school shooting this year in Kentucky, and the discussion on a state level has been much around how we need increased counseling services in schools. Well, I don't disagree with that, but we need increased nursing services in schools, because these children are coming to the nurses office, and they're coming with somatic complaints, but oftentimes there's underlying issues, and nurses can build those relationships that will help bring those risk factors to the surface. And then across this whole country, especially in Kentucky, we have opioid-impacted children, families, schools, and communities, and nurses are at the front line of helping to intervene and address those issues. Thank you.
Thank you. Eva, thank you so much for sharing that school district administrator and school nurse picture of the opportunities in ESSA through chronic absenteeism interventions. And we're so grateful that we had this partnership with ESSA, with the Alliance for a Healthier Generation, with Eva from that district level and school level, and Alex Mays, who partnered with us from Healthy Schools Campaign and brought us this. So now we have time for questions. Please write your questions in the question box. We have a few questions already that we will answer. And Anessa, I want to ask you to respond to the first question, which is, what is an LEA?
LEA, Local Education Agency.
Okay, thank you. And Alex, thank you for allowing this partnership to use the platform from Healthy Schools Campaign to bring this webinar. Could you give us and remind us again of what will be coming at the end of this week regarding the slide deck, recording, and other items?
Yes. So I know we've had a number of questions from people wanting to know if slides are available. So at the end of this week, you'll get an email, just like you got an email for the registration for this webinar, and it'll include a link to the slides, a recording of the webinar, and the links to the handouts that were mentioned throughout today. So we'll be sure to get that out. It will go to all registrants from the webinar, so those who participated and those who didn't.
Very good. Thank you. And Eva, we have a question for you. Are you using aggregate health data to identify possible root causes?
Yes and no. So we look at aggregate, for example, right now, where I'm working, we're looking at aggregate data on asthma. And so we're in the process of working to implement some standing orders to use albuterol in the schools. And so from that perspective, yes, we look at aggregate data just to see what kind of interventions that we can do. But the aggregate health data is only as good as what's been entered into the student data system. And so right now, what I would say is we have to spend time making sure that we are capturing health data and tying it to absences in the students. So we are looking at aggregate health data, and we are looking at on a district level, but right now the work is trying to get some systems in place where we can support those students being at school.
Thank you, Eva, and want to repeat Eva's last name, Eva Stone from Kentucky. Eva, there's another question for you. What would you recommend for schools and districts that don't have a school nurse in every building?
I would recommend that you first start, because that's the situation that we're in now, and that's the situation most places I've worked. It was just 1 year we were fortunate to have one in every building, is to get your data, because you have to paint a picture for what's going on in your school district. And so a lot of times that builds the case for the reason that you need a nurse. A lot of times administrators may not know what they don't know. And we can't assume as nurses that educators who are very well attentioned but haven't been trained in the same medical way that we have translate that to how that impacts the student in the classroom. And so the most important thing to start with is getting data and looking at your data. And it's very surprising when you start to look at the percentage of kids who are chronically absent, and you see those numbers, and then you start looking at health conditions. it tells a story of the need that you have in your district.
Great. Hold on. Eva, we have another question for you. You mentioned a professional learning community for school nurses. What tools did the school nurse use to develop that professional learning community?
So what we did is we named our committee an at-risk committee. And so then that evolved a little bit into, if everybody else is speaking about professional learning communities, then in my vernacular, I needed to use professional learning communities as well if I wanted principals to understand what I was talking about. So we talked about PLCs for chronically absent students. And so what we had is the committee members that I mentioned, that I had on the slide, that comprised this team, and we scheduled regular meetings, and then we went to every meeting with a list of the kids who were chronically absent. We started the school year with a list of those who had been chronically absent the year before. And then as the year progressed, we would start working on the currently chronically absent students, those kids who now had, by October, had missed 4 days of school, for example. And so we started trying to get ahead of those kids so we can intervene early on. So we didn't use anything in particular to create a PLC, but we kept information, followed the data, and did a lot of the work that PLC mentality was doing.
Thank you. And for Anessa and maybe Alex, one last question we have time for. To what extent are federal agencies providing guidance to state agencies in terms of what partners to engage in meeting student needs? You know, whether it's healthcare providers, unions, and how to engage those partners given their historically siloed work. And looking at that from federal to state agency, and also from state agency to district level.
Anessa, I'm happy to take a first pass at it, and then please feel free to jump in. So there has not been a lot of federal guidance coming out from the Department of Education around the Every Student Succeeds Act, but there are a lot of really good resources that are being put out by national stakeholder groups around stakeholder engagement and what that can look like. The Opportunity Institute is one that's doing some really nice work around that. The Community Coalition for Community Schools have all really taken on this issue of how to engage in robust stakeholder engagement around ESSA implementation. And so certainly we can include links to some of those resources in the follow-up materials. But we have not seen, nor are we expecting to see much guidance on that specific issue from the federal agencies. And it's really been the nonprofit partners that have been putting out some helpful materials on that. So, Anessa, anything to add?
Yeah, I'll just echo what Alex said, and I was going to suggest that we put some materials some resources in the follow-up materials. The Council of Chief State School Officers has a nice packet all about like partnering and collaboration, which I've tapped into. So I would say we'll definitely include some, but like Alex said, it's coming more from national and nonprofit level, not necessarily federal guidance.
Thank you. And we see the questions and the comments about advocating for students to have the school nurses they need, and question about financially supporting the increased staffing of school nurses so that they can identify social determinants of health. This has been a great webinar. We have this recorded. You can listen again and share it with others. And again, thank you to the Healthy Schools Campaign, Alex, and Alliance for a Healthier Generation, Anessa, and from Kentucky, but with a very global mindset, Eva, at Stone, helping students succeed through better health and learning. Thank you so much. We will end the webinar now. Thanks for coming.